There's a pattern that plays out every single year, and once you've seen it, you can't unsee it. Some ordinary, inexpensive item at the pharmacy, the kind of thing nobody gives a second thought to, suddenly becomes impossible to find. The shelf sits half empty for weeks. The price on what's left creeps up, and the people who quietly stocked it ahead of time barely notice while everyone else is driving from store to store hunting for it. We've watched it happen with all sorts of basics in recent years, and it keeps happening because supply chains are more fragile than they look, and demand spikes faster than the shelves can be refilled. For a senior, especially one on a fixed income, getting caught short on a health basic isn't just an inconvenience. It can genuinely matter to how you feel and how you weather an illness. So today I'm going to walk you through 10 cheap pharmacy items that smart seniors are quietly stocking before the shelves go empty. None of them cost much. All of them are things you'll use eventually anyway. And I'll be honest with you throughout about which ones to run past your pharmacist first, because at our age, that part genuinely matters more than anything. But remember, the very last item is the most important of all, the one that protects you more than everything else on this list combined. Stay with me to the end for that one. Let's go. Number 10. Saline Nasal Spray. Let's start with the one almost everyone overlooks. As we head into the drier, colder months, with the heat running indoors all day, the air in our homes gets brutally dry, and that dryness cracks the delicate lining of the nose. That's not just uncomfortable, it actually leaves you more exposed to every cold and flu virus floating around. A plain saline spray, which is nothing more than gentle salt water with no medication in it at all, keeps those nasal passages moist and helps clear out what you've been breathing in all day. For older adults, it also helps with the nosebleeds and stubborn stuffiness that dry indoor heat brings on. It costs only a few dollars, it's completely gentle, and unlike the medicated decongestant sprays, you can use plain saline freely without the rebound congestion those can cause. Pharmacies run low on the simple versions fast once cold season hits, so grab 2 or 3 bottles now while they're still on the shelf. Number 9. Cough drops and throat lozenges. Simple, cheap, and genuinely useful the moment a winter cold settles into your throat. A sore, raw throat doesn't just hurt, it keeps you from sleeping, and sleep is precisely what your body needs to fight off whatever you've caught. A good lozenge soothes the throat and quiets a nagging cough long enough to actually rest. One thing worth knowing for our age group, a lot of standard cough drops are loaded with sugar, so if you're managing diabetes, look for the sugar-free versions, which work just as well. They keep for a long time in the cabinet and take up almost no space. Buy a couple of bags now, because the moment cold season truly arrives, these are among the very first shelves to empty and the slowest to restock. Number 8. Hand sanitizer and disinfecting wipes. We all learned the hard way just how fast these can vanish from the shelves and how high the prices climb when they do. As we move into the season of being indoors more, with germs circulating freely, keeping your hands clean and your common surfaces wiped down is one of the simplest, most effective ways to avoid getting sick in the first place, and avoiding illness is always better than treating it. Hand sanitizer is invaluable for the times you can't get to a sink, and disinfecting wipes make quick work of doorknobs, counters, and the things many hands touch. Both store well, both are cheap right now, and both are exactly the kind of thing that disappears the instant a bad bug starts going around. Stock a good supply while it's easy. Number 7. A reliable thermometer. This one isn't a medicine, it's information, and that information matters more for seniors than most people realize. A fever is your body sounding an alarm, but in older adults that alarm can be quieter. Sometimes a serious infection shows up as only a mild temperature, and sometimes a low fever is the first sign of something that needs real attention. You can't make a good decision about whether to rest at home or call the doctor if you're just guessing with a hand on your forehead. A simple digital thermometer costs very little. Buy one now, test it to be sure it works, and keep a spare set of batteries right alongside it, because a dead thermometer in the middle of a sick night is no thermometer at all. It's worth keeping a backup too. Knowing your real numbers takes the panic out of being unwell. Number 6. A basic pain and fever reliever. Most households keep something like acetaminophen on hand for headaches, aches, and bringing down a fever, and it belongs in any well-stocked medicine cabinet. But here is where I'm going to slow right down and talk to you plainly, because this is the item that needs the most care for our age group. First, acetaminophen is hidden inside a great many multi-symptom cold and flu products, so it's surprisingly easy to take it twice without realizing it, and that's genuinely something to be careful about. Second, many of us simply cannot safely use the other common pain relievers, the ibuprofen type ones, because of blood pressure, kidney concerns, stomach issues, or the blood thinners we may already be taking. So before you stock anything in this category, please have a real conversation with your pharmacist about which pain reliever is right for you specifically, and how much is safe given everything else you take. That conversation costs nothing, and it's one of the smartest 5 minutes you'll ever spend. Then stock what they recommend. Keep it well within the dates on the box and never exceed what the label says. If this is the kind of practical, look out for yourself information you came here for, a quick like genuinely helps this channel reach other seniors and the families who care for them. It's completely up to you, but it truly does help a small channel keep going. Now let's get into the top 5, because these are the ones people thank me for most. Number 5, oral rehydration and electrolyte packets. Here's something that catches a lot of older people off guard. Winter brings stomach bugs and the flu, and both of them can pull fluids out of you fast, through fever, through an upset stomach, through simply not feeling like eating or drinking. The trouble is that as we age, the body's thirst signal grows weaker, so you can be genuinely dehydrated before you ever feel thirsty, and dehydration in an older adult is no small thing. It can leave you dizzy, confused, and weak enough to fall. Plain water helps, but it doesn't replace the salts and minerals you lose. That's exactly what electrolyte packets and oral rehydration solutions are for, and they work far better than water alone. They're inexpensive, they store for a long time, and a small box could spare you a miserable few days, or even a trip to the emergency room. Keep several on hand and know your limits, because if you truly can't keep fluids down, that's the moment to call your doctor rather than tough it out. Number 4, antacids and basic digestive relief. The colder months change how we eat, heavier comfort food, richer holiday meals, more time sitting indoors and less time moving around. All adds up to more heartburn, more indigestion, and more sluggish digestion than usual. A basic antacid handles the occasional bout of heartburn, and it's far better to have it on hand before you need it at 10 o'clock at night than to go hunting for it then. There's a second, quieter problem too. Less movement and less water in the cold. Months often means constipation, which is genuinely common and uncomfortable as we age, so a gentle fiber supplement is a sensible thing to keep alongside it. One important caution here though, antacids can interfere with how your body absorbs some prescription medications, so ask your pharmacist whether you need to space them apart from your regular pills. A small thing to check, but well worth checking. Number 3, wound care and first aid supplies. This one earns its place specifically because of how older bodies work. Our skin grows thinner and more fragile with age, so a small bump that a younger person would shrug off can become a real skin tear. For us, we heal more slowly, which means a small wound left unattended has more time to turn into a problem. So put together one simple, well-stocked kit, kept somewhere you can reach it easily, not buried in a closet. Adhesive bandages in a few sizes, some sterile gauze pads, medical tape, and antiseptic wipes, or an antibiotic ointment to keep a cut clean. Keeping a wound clean and covered is what gives it the best chance to heal properly. One honest note, if you're managing diabetes or any circulation issues, watch any wound closely. And if it isn't healing the way it should, don't wait. Get your doctor to look at it. Healing well is half preparation and half paying attention. Number 2, vitamin D. This is the one that's easy to overlook and hard to overstate, especially as the darker months arrive. Your skin makes vitamin D from sunlight, but in the colder months you're indoors more, bundled up more, and the sun sits lower and weaker in the sky. On top of that, older skin simply makes less vitamin D than it used to, even with the same amount of sun, and the result is that a great many seniors run low on it exactly when they need it most. Vitamin D supports the bones, which matters enormously when a fall could mean a fracture. It supports the immune system right when cold and flu season hits, and it plays a real role in mood, which helps with the heaviness so many people feel during the short, dark days. It's inexpensive and it stores well. But, and this matters, the right amount is different from person to person, and more is not automatically better. So ask your doctor or pharmacist what dose is right for you before you start, rather than guessing on your own. And number 1, the smartest, quietest move of all. Getting ahead on your prescriptions. This is the item nobody puts on these lists, and it's the most important one by far. Everything else we've talked about is for the small stuff, the colds and the aches and the upset stomachs. But the medications you take every single day for your heart, your blood pressure, your blood sugar, whatever keeps you steady and well, those are the ones you absolutely cannot afford to run short on during a storm, a supply problem, or a week when you're simply too sick to leave the house. So well before any of that can happen, sit down with your doctor or your pharmacist and ask 2 simple questions. Can I get a 90-day supply instead of refilling every single month? And can I refill a little early so I'm never caught down to my last few pills when bad weather or an empty shelf gets in the way? Then get yourself a weekly pill organizer, the kind with a slot for each day, so you never miss a dose and never accidentally double up. Which gets easier to do than any of us would like to admit as the years go on. And keep a current written list of everything you take, with the doses, somewhere easy to find. This isn't about hoarding, and it isn't about fear. It's about making sure that the 1 week you can't get to the pharmacy is never the week you run out of the medicine that keeps you well. That single bit of planning protects you more than everything else on this entire list combined. Now let me say a quick word about why these shelves actually go empty in the first place, because understanding it helps you shop smarter. None of these items is truly rare or hard to make. The problem is that demand for them spikes suddenly and all at once. The very moment a bad cold season arrives, a bug starts going around, or a storm has everyone preparing at the same time. Supply chains simply can't refill the shelves as fast as a frightened crowd empties them. And so for a few weeks the basics vanish and the prices on whatever's left drift upward. That's the entire pattern, and the lesson in it is simple. The calm, ordinary weeks, the ones before everyone else gets the same idea, are exactly when you should quietly lay in your supply. You're not panicking, you're just refusing to be caught in the rush. And a few practical reminders on keeping all of this properly. Store your medicine somewhere cool and dry, and here's a surprise to most people. That means not the bathroom cabinet, because the heat and humidity from the shower actually break medications down faster. A bedroom drawer or a kitchen cupboard away from the stove is far better. Check the expiration dates on everything a couple of times a year, perhaps when the clocks change, and replace anything that's gone past its date because expired medicine can lose its strength. Keep it all together in one place you can reach easily, not scattered across the house, so that when you're feeling poorly, you're not hunting through 3 rooms to find what you need. And just as with your prescriptions, keep a simple written note of what you have and when it expires. A little organization now spares you a great deal of fumbling and worry on the day you're actually unwell. And one last bit of encouragement before we wrap this up. Putting a small reserve like this together isn't about living in fear of empty shelves, and it certainly isn't about hoarding more than you could ever sensibly use. It's about the simple, settled comfort of knowing that when a cold finally catches up with you, or a stomach bug knocks you flat, or a storm keeps you housebound for a few days, you already have on hand exactly what you need to take care of yourself without having to drag yourself out into bad weather while you're feeling your very worst. That kind of quiet readiness is one of the great, underrated comforts of growing older wisely. Don't forget, too, that your pharmacist is one of the most valuable and most underused resources you have, and the advice costs you nothing at all, so lean on them, ask your questions, and let them help you choose well. And if you happen to have an older friend or neighbor who lives alone, consider helping them put together a small kit of these same basics, or simply checking in on them when the weather turns cold or a bug is making its rounds. The kindest preparation of all is the kind we quietly extend to one another, and a single phone call to ask how someone is feeling can mean far more to them than they will ever find the words to say. So there are your 10. Saline nasal spray, cough drops and throat lozenges, hand sanitizer and disinfecting wipes, a reliable thermometer, a basic pain and fever reliever, electrolyte packets, antacids and digestive relief, a wound care kit, vitamin D, and most important of all, a real plan to stay ahead on your prescriptions. Not one of these is dramatic, and not one of them is expensive, but every single one addresses something that quietly turns from minor to serious faster in an older body. At the exact time of year, these troubles all tend to arrive together. You don't have to gather it all at once. On your next couple of trips to the pharmacy, pick up 2 or 3 at a time, and on one of those trips, take 10 minutes for that all-important conversation with your pharmacist about your pain reliever, your vitamin D, and your prescription refills. The people who get caught short aren't careless. They simply waited until the shelves were already bare. You're not going to be one of them. So tell me down in the comments, which of these 10 are you going to pick up first? Saying it out loud is a good way to make sure you actually do it. Take good care of yourself, and I'll see you in the next one.